Over the last 20 years, I've performed over 3,500 tummy tucks, which is probably more than most practitioners in this country. The same questions appear to come up over and over in consultation with my patients. The difference between mini tummy tuck, full or standard or extended abdominoplasty, which is what I like to call my larger tummy tucks, is usually something that causes a lot of confusion with my patients. The confusion, especially with a mini tummy tuck, most patients think it implies a shorter incision, which in most cases, a mini tummy tuck does have a shorter incision. But additionally, a mini tummy tuck might require a smaller excision of skin and fat and possible no reposition of the umbilicus or belly button. A standard tummy tuck or full abdominoplasty requires a longer incision, usually iliac crest to iliac crest or hip bone to hip bone, with elevation of the abdominal skin all the way to the lower edge of the ribs and translocation of movement of the belly button. The biggest part of this procedure, the key part of this procedure, is a repair of the rectus diastasis, which means bringing these muscles back together, much like a corset, which provides my patients with a flatter, optimal result. An extended abdominoplasty is a term that I like to use to describe a tummy tuck that's usually required in patients who've lost a large amount of weight and who have redundant skin that extends beyond their hip bones. I like to say the incision goes over the horizon on both sides of the patient's trunk. This is required for a perfect correction or a correction that does not leave dog ears or redundancy. So please keep in mind, with a mini tummy tuck, incision may be smaller, but it also refers to whether or not a large amount of skin and fat are removed and the belly button is possibly moved or left in place. A standard or full abdominoplasty has a longer incision, involves a much wider area of dissection to allow the movement of skin downwards. The belly button is usually excised and allowed to exit through a new opening or is floated.